this is going to be an amazing hour. I'm with one of my favorite idols and everyone on Dental Town's thought leader, Jason Luchtefeld. Jason is a decade younger than me. I'm going to be 52 next month, and he hasn't hit 40. But Jason, I knew this guy had a outside the mind thinking. I had made some comment. It must have been a joke or a slam of environmentalism or whatever. And he sent me a book, Cradle to Cradle, which was made out of recycled plastic, paper, or whatever. And he sent it to me. And at first I thought it was a joke. And I read that, and it completely did my mind a 180-degree U-turn, because this was, I don't know, what was it, 15, 20 years ago you did this to me? And it was the first time a businessman explained to me sustainability. And then it's not some, but I think before you sent me that book, I thought of environmentalists as a bunch of hippies and free love and a van with peace signs, and they didn't get it. And this book showed me that, you build a house out of rock, it's going to be there in 100 years. You build it out of cheap stuff and you just keep replacing it. You put carpet down, and every 10 years you're replacing it, filling up landfills. It's releasing formaldehyde. But if you put tile down there, it'd be there 1,000 years. And then, I've lectured in 50 countries, and you start realizing everything they show you, a castle that's 1,000 years old, it wasn't made out of plywood and straw and whatever the hell they built my house out of. It was all rock and stone. And then I started realizing that sustainability is actually lower cost. I mean, you're digging up this hole to make copper, and then you're making a battery, use it for a week, and then you're digging another hole and throwing it away, and none of it makes sense. And that's just one example. So I guess I want to, and also you've been a huge role model for me. I've fought obesity my whole life. And when I was 50 years old, I realized my dad and two granddads, they all died at 61. And then when I turned 50, I thought I got my new granddaughter. I had 4 boys. I finally got the granddaughter, the greatest thing in my life. And I realized, hell, I'm not even going to see her graduate from high school. And so I started getting into trying to get into health. I did my first Ironman. I got another one in 100, my second one in 100 days. And gosh darn, you're just, no matter what it is, you think critically. And I want to talk about that, because if we're going to uncomplicate dentistry, if we're going to uncomplicate our lives, our business, our house, everything, you got to learn how to think critical. And Jason, out of the world's 2 million dentists and 180,000 of them on Dental Town, you're the best critical thinker that I've ever met. I'm a big fan of your podcast. Tell them about your podcast, and let's talk about critical thinking, how it applies to amalgam, how it applies to composites, all kinds of examples.
Yeah, well, first, Howard, it's an honor to be on with you at the beginning of your podcasting career here, and I think you're going to do fantastic. So, yeah, my history on Dental Town goes back to when I was in dental school. And I was a senior when I found Dental Town, and Dental Town helped me through getting into residency. It helped me through starting my practice from scratch in Colorado, and then through all the times that I've sold and moved and bought and sold and moved and bought, and to where I am now. So it's been a huge part of my life, my entire career in dentistry. So thank you for that as well. So to get into critical thinking, I think that there's a huge need for it in dentistry because of the various areas that you mentioned, and to uncomplicate dentistry. I think there's too many people out there on the stage that are talking about complex, complicated treatment. And it's easy for us sitting in the audience with the pie in the sky and the excitement of what comes with these full mouth rehabs and these complicated cases, and to think that we can cure somebody's spina bifida with an oral appliance or whatever it may be. But what we're lacking is the ability to look at that and then ask better questions about how that's happening and why that's happening, and is it really plausible or not. And if it's not plausible, then why would we spend more money in that area? Why would we complicate our lives or the dentistry that we're trying to do to just get people by? And so what we've done is a colleague and I, Grant Ritchie, he's a dentist in Kansas City and also on Dental Town, and he and I met at actually a scientific conference outside of dentistry and had dentistry in common, and we're talking for quite a while just online and had similar interests in trying to bring more critical thinking into dentistry, and then also had interest in science and I kind of like fitness and nutrition and that kind of world. He's more into astronomy and some other things. And so we had these ideas, and about 9 or 10 months ago, we decided we'd finally just see what happens with a podcast. So we started a podcast. It's called the Prism Podcast, where we are trying to just evaluate and learn about scientific and critical thinking topics. So we have all kinds of things, not just dentistry, although we do jump into dentistry on a regular basis. So we've tackled some sleep apnea issues. We've tackled a whole segment, or actually 2 segments, on Cariology, which were really well done, I think. And we've gotten into other areas as well, from health reporting. We had a health and science journalist from the UK on. Next week, we're interviewing somebody from Sense About Science. They're based in the UK, and that's an organization that is entirely sprung up around educating the public on scientific thinking and asking better questions and asking for evidence, and the whole idea being to make our lives simpler and smarter, not supernatural.
Well, anybody who listens to one of your podcasts is going to listen to the whole series. I mean, they're just amazing. Every time I see one fly across my desk on Twitter, I try to retweet it. Well, let's go through the 3 critical areas the areas you were just talking about. Cariology. Then you go back and listen to a couple of whole segments on yours, but I only get you for an hour. Let's talk about Cariology.
Yeah. So Cariology, it was interesting to me because going back, there was a lot I forgot in dental school. And so as I'm seeing more and more patients that have these challenges, and I'm trying to counsel them on what to do and try and find an organized way to present it, it was challenging. And it's not always something that's the patient's fault, is what I learned. And so all we can do is give them the best information and the best tools to try to combat this disease. So what we did in our podcast was we tried to find a couple people that were interested in the topic. So we had Kim Cooch on, who obviously has a company, has a product to sell, and so that we have to take that with a little bit of a grain of salt, but he did have some good information to present. And then we had a dental researcher, Dom Zero. He's a researcher at Indiana University. He's been doing Cariology research for 30 years, I think. And so it basically comes down to something that's very simple, but not well enough known. And that is that if we can just alter the environment of the mouth in a way that is no longer advantageous to those bugs that cause cavities, that we can change people's entire risk profile for getting a cavity. And so what I've done then is simplified my practice to anybody that has an active cavity gets this information. And it's a little brochure we made up that says, look, you're at risk for cavities. We know that you have the bugs. We know that you have the tooth. We know that you have the diet. And so you modify these things, and here are some recommended tools and tips and techniques, and you can never have a cavity again. And so it's made it simple.
How can our readers see that pamphlet?
Say that again?
How can our listeners on this podcast, how can they see that pamphlet that you give your patients?
Yeah, the easiest way would be to email me or ask the question on Dentaltown, and I'll respond.
What is your email?
My personal email is jluchte@hotmail.com.
Okay. And will you email it to, do you have it in a JPEG? Can you email it to me?
It's in a Word document currently.
Can you send it to me in a Word document?
Yep.
And then when we post your podcast, maybe we'll just start it with Cariology. Maybe we'll post it under Cariology, and then you can post that, or I can post it for you after your podcast. It'll be the first comment after your podcast. So what does that brochure basically say? Let's start with the bug itself. I've learned recently that it looks like we picked up Streptococcus mutans from cats probably 15,000 years ago in the Fertile Crescent, and that it's you're not born with it. We picked it up from cats, just like we picked up other diseases from animals, and that you have a newborn baby and mom and dad are kissing it. They're tasting its food, and it's actually the whole dental industry. You got infected from your mom and dad.
That's right.
Well, what I like to say is mom, not the dad.
Yeah, so that's a really interesting
that was a joke.
topic. Yeah, that's come up. That I think that so strep mutans and lactobacillus are the two really big ones, and when they're together, it's a synergistic effect in the negative. And so you get those, as you already said, from parents most commonly, but also from caregivers. So it can be grandma and grandpa, it can be the babysitter, it can be kids at their babysitters. So, kids put stuff in their mouths and it goes to the next kid's mouth. It was originally thought, not that long ago, that it wasn't until the first tooth eruption that was a problem. But lately, they're finding that stuff can even embed on the rugae, the gum tissue, the tongue. And so it makes rubbing the kids' gums with a washcloth before they have teeth even that much more important. And
now, do you have to have both of those bacteria for a cavity, or you can just have strep?
No, you can just have strep, and that will cause cavities. And you can have not strep and just have lactobacillus and have some cavities, but it's a lot lower risk. But if you have both, it's like a curve that arcs up. That when you have both of those, it's dramatic.
And is that the same bug in root surface decay?
As far as I know.
Okay, and meth mouth and et cetera.
Yeah.
Okay.
Yeah.
So,
and obviously there's other things involved when you get into some of that, as far as the acid levels in the mouth. And if there's dry mouth associated, then not only the higher risk from a surface that's not getting washed daily, but you also have the dryness that facilitates a lower pH.
Now, Jason, can we envision in the near future that maybe parents could not infect their child, or is it a hopeless situation in our society that someone's going to kiss you, or you're going to put them in school for 1 hour and they're going to pick up a ball from McDonald's in the ball area? And, is I'm not going to get my child infected with this a strategy, or is that just really not even a strategy?
I don't think so. I wouldn't tell someone to stop kissing their kid because they're worried about it. But what I would say is that if a parent has a lot of cavities and a high risk, they should be doing things to lower their risk, not just their kids. So they need to be, eating different and brushing and flossing and fluoride and doing all the things necessary to get that bug as low as possible in their mouth.
And I've seen a lot of things change in my 50 years of life. I mean, I've seen a lot of things. Do you think a vaccine for Streptococcus mutans or lactobacillus is around the corner, or is that way down the road too?
Yeah, as far as I can tell, it's a way down the road. There are some other things that are kind of in the pipeline, some other gums and things that are peptide based that affect the bacteria differently, that are a lot closer. And
talk about that for a minute.
Yeah, they're actually studying it. It's in our episode with Dom Zero, where he's one of the researchers, and it's a military research grant that they're researching this peptide that specifically affects these bacteria. And so they've made a gum out of this peptide for the troops when they're overseas and away from things, to try to alter their risk for cavities in a more dramatic way. And initial data that he could be open about was very positive.
Okay, so you said three things. We talked about the bacteria, and then the other two were diet.
Yeah, the bacteria, the diet, and I don't know if I said acid levels or if I said
pH.
Yeah, pH. So the diet is critical. So the carb snacking is the big one, and it's been amazing since I've now approached it with in the last 12 months is really how long I've been doing this part of it, and that is kind of the diet focus for caries risk people. And that is, they all know about sugar. They all know soda's bad. They all know that the sugary sweets and things are bad. And so they recognize that, and they say that they will avoid those. What they don't know is carbs in general. And so everyone thinks a cracker is healthy, but you snack on a cracker and that shit is in your teeth for hours, just ready for a feast from those bacteria to cause cavities. And so crackers are a big one that parents give to kids. I mean, all day long, they give them the crackers thinking they're healthier than giving them sweets or other snacks. And so that's been an eye-opener for patients that I've had the discussion with, that crackers can actually be a negative for cavities. So the big one there is carbs. So don't snack on carbs. And if you do, mix it with some fats or rinse immediately.
It's tough. I've lectured in all around the world, and the 3 fastest growing diseases around the world are dental decay, obesity, and diabetes. And it's all what we're putting in the mouth.
Yeah, absolutely.
And it's amazing. Just last year, I was in 3 different cities in Asia, Hong Kong, Nepal, Kathmandu, Nepal, and New Delhi. All 3 of them, for the first time in the history of their great civilizations, got their first pediatric dentist. And I was in Kathmandu talking to a dentist who was 60 years old. So then his first 10 years of practice, he never saw a cavity ever in a child under 10. And then the whole country quit drinking water and switched to Coca-Cola and Pepsi and all this processed foods. And now he says any 5-year-old that walks in, he basically said any child that walks in for their age will have that number of cavities. A 5-year-old will have 5, a 6-year-old will have 6. And it's just crazy. And so our diet.
I think that's a great point. It's not like they don't have the bacteria. So that's, I think, a great case study there, that they probably have mouths that are full of this bacteria, but they never fed them anything that they could eat. And so even though you have the bacteria, if you're not feeding it that carb, that sugar, then you're not going to get cavities.
That's a great point. So then I'm going to ask you, the last thing you said was the pH. So there's a lot of people who believe I'm going to quit drinking Coke and I'm going to drink Diet Coke and then my dentist will love me. Talk about that.
Yeah, so the acid levels in the diet soda are the exact same. No different there in all the sodas. And even what's worse nowadays, as you've probably seen, are all these sports drinks and things like Red Bull and Monster and whatever else. They're just full of citric acid. And I see it a lot in some of the endurance athletes that I've spoken to and gotten to correspond with. And that is that you may see in your Ironman stuff. The stuff you're putting in as you're on your bike for hours and hours, it's sugar-based, and if it's a liquid, it typically has citric acid in it to help to stabilize it. And so that citric acid is bad, the phosphoric acid, and whatever other acid is used in a variety of soda products is just going to tear the teeth up.
And I also just read a study just a couple of weeks ago that swimmers actually have a higher decay rate. So you're thinking your mouth's bathing in chlorine. Chlorine kills everything. That's why a swimming pool, you can see the bottom of the pool. Yes, swimmers have higher cavity rates. Explain that.
Well, the pH level in a pool, especially a public pool, is probably not real balanced at like 7.0. And so my assumption there is that you have an acidic environment in that pool more often than not.
Well, I live in Phoenix where you have to have a pool, and everyone knows that every time you lower the pH by 1, the chlorine kills twice as much. So you dump in chlorine and acid.
Yep.
And so it's the low pH. And explain to the dentist why a low pH promotes decay.
Well, the bacteria that can help cause cavities, one, they like the environment. They can survive in an aciduric environment. They're acid loving. And they're also acid producing because it's the acid that helps to eat away the tooth structure. Not that they have a conscience and they want to do that. That's just what they do, right? It's their instinct to eat and to poop, and that destroys teeth. And so that acid environment, if you're bathing your teeth in acid along with what the bacteria are doing, then you're just making their lives easier.
So if you were talking to a mom and dad and they had a bunch of puppies, what would you be telling them? You'd be coaching them less sugars, less crackers, less carbs, less acid. Would you be recommending gums that have ingredients to Xylactin and all those. Talk about that. Well, talk to me. Like I just came into you and said, hey, I got 3 kids, 2, 4, and 6. What are you going to tell me at a recall appointment, to help my kids?
Yeah. So that depends. So in my attempts to try to uncomplicate life for my hygienists, I don't require them to have a dissertation with every single patient. I prefer a more customized approach with each person. And so if I have a family of 5 that come in and the kids don't have any cavities and the parents don't have any cavities, then our conversations are really short because obviously they're not at risk. Whatever it is they're doing, it's working, and I don't need to spend 20 minutes educating them. But if the family comes in and dad's got a mouthful of cavities and teeth rotten off, and 2 out of the 3 kids have a bunch of cavities and problems, then it's a different story. Then we'll bring everybody in and we'll say, okay, mom and dad, first, do you know what causes cavities? Usually they'll sort of nod with a question mark look in their eye. And so we'll review it with them, just the basic process, that it requires teeth and bugs and a food source. And then we'll say, we need to try to alter this environment so that you don't get cavities anymore. And we have the ability now to do that very predictably. So what that means is no more of the sugar snacking like we talked about, eliminating sodas and juices. And usually it's easier for the kids to be instructed to do that. It's more the adults that are the problem, and that they like their soda during the day. They like that pick me up, or they want the caffeine, various stuff.
The adults or the kids?
So, the adults.
Okay.
So then it's a matter of trying to just come to an agreement with them that, I've found that you can't ask too much of them or you get zero compliance. Instead, it's finding a middle ground. And so you say, have your soda, but have it with a meal. Don't sip on it all day. And for the kids, it's the same sort of thing. Avoid the soda, except on special occasions. Avoid the sugary snacks, except for special occasions. And then alter the environment with this. Brushing twice a day. Make sure you have a fluoride toothpaste. Rinsing for the kids. Act mouth rinse is awesome. For the adults, we do some Cari-free products. A little higher strength and more tolerable for the adults than the kids. And then, as you mentioned, xylitol, gum, and mints. We do recommend those for people to use through the day, especially if they're already gum or mint users. So people that are sucking on Altoids all day, we try to get them to switch to a xylitol mint instead. People that are snacking on gum all day, we try to get them to use 100% xylitol product instead of their juicy fruit. And
any name brands that you like?
For the gum, we use Epic.
Epic?
Yep. For the mints, we use Ice Chips.
That's the name of it, Ice Chip Mints?
Yeah, Ice Chips. Yeah, they were on Shark Tank last year.
Really?
That show, it was 2 grandmas that invented it, and they went on Shark Tank and pitched their Ice Chips, and they actually got funding. So I think the parent company is now called Healing Leaf Incorporated or something.
Would it be healingleaf.com?
That's a great question.
Did Mark Cuban invest money in it?
I don't know. I haven't watched the episode.
Oh, okay.
It's icechipscandy.com.
Icechipscandy.com.
Yeah.
Fantastic. And that I could get the Epic Xylitol gum and the Ice Chip mints.
No, that's the mints only.
Okay, ice chips what?
Icechipscandy.com.
Okay, icechipscandy.com.
And they have like 20 different flavors that are really good and easy. The gum is Epic, which is Epic Dental.
That's so epicdental.com, EPIC dental.com. Yeah. Okay.
Yeah.
And then I want to you're talking about children. Let's go to the other end of the spectrum, something that's really has my attention. So I'm in Phoenix. It's a big retirement community. I'd say about 20% of my practice are people that retired here from the Midwest and Northern Midwest, basically you go into a nursing home and your life's long dentistry that you restored, about 18 months later, it's just root surface decay. It's just dang near wiped it all out. And it's sad. What would you say to the LPNs working the nursing homes, the nursing home director, or to a couple who's going to put grandma into the nursing home, knowing that probably, I mean, what percent, have you seen nursing home data? I mean, what percent of the people admitted to nursing home will just get attacked by root surface decay?
Yeah, I haven't seen the data myself, but I know that it's not good. And I know that the ability to get quality oral health care in a nursing home environment is very challenging. I think, and this is from a few patients that I've had that have gone through that exact process, that the staff are already pretty overworked. At least that's what it sounds like, the nurses and things. And so trying to adequately brush someone's mouth that doesn't have the ability to help very much is a real challenge. Combine that with the myriad of medications that these people are on that dry the mouth out and leave them susceptible. Combine that with the diet that most of them are on in these places, and you have an environment that is ready for some serious decay.
And rheumatoid arthritis that can't handle the brush, dementia, Alzheimer's. It's just a cluster. So what would you recommend to say a patient who's going to go visit her mom in the nursing home? Would you and I've checked out about 10 of these, and it's some poor LPN little girl, and she's in a wing with 10 rooms on each side, and there's 2 row room, and she's supposed to be in charge of staying in the bathroom and bathing them and this and meds and that. I mean, when they go in to brush their teeth, they squirt a little something on it, go bing, 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 and spit in a Dixie cup. So if your mom was in a nursing home in this situation, how would you counsel her? Would you?
Yeah, so one thing, I think the Cari-Free treatment rinse, which they may have just renamed to CTX4, it's basically peroxide and bleach and some other ingredients to try to flavor it, would be a great rinse to use once or twice a day.
And what's the website on there?
That's carifree.com.
Okay, Cari-Free or Cari's Free?
Cari, Carifree. Is that
Cooch's?
Kim Cooch's
website, carifree.com.
Yep.
Okay.
Yep. So their treatment rinse, or CTX4, is that high-powered, and what I tell patients, it's like a prescription strength rinse, because it's got stuff in it. They're going to hopefully have some data, actual published data released later this year that will help to back up give it some science behind the theory. But that does multiple things. It has fluoride in it. It kills bugs. It has a buffering agent in it, so you're addressing the acid, and it has xylitol in it, so you're getting that effect.
So it's just a cocktail of about anything we got. We got the buffer agent. So what is that? Baking soda, some fluoride, some peroxide, some bleach, and some. Very good.
Yep. Yeah. So I like the product for that reason, and I think for people that have very little care, very little time, and ability to do that, it's all of 10 seconds for someone. It does come in 2 bottles in order, because it's not stable once you mix it. So you do have to pour a little bit and a little bit, and then swish it. So as long as the person can swish, that would be golden.
And how long would they have to swish with something like that?
Oh, probably 30 seconds.
30 seconds, okay.
It doesn't need to be long. And it's not like Listerine where you have to, make it burn for 10 minutes. So.
Well, is there anything else you want to say about Cariology, or you want to?
No, I think we've touched on it. I think that we've done some things, both in my office and through the podcast, that can help to simplify that conversation for dentists.
Okay.
So. Yeah.
Okay, so critical thinking. Let's jump to the next issue. Sleep apnea.
Yeah.
That seems to be a big buzzword. I mean, you can't pick up a magazine anywhere in America without talking about sleep apnea. Even.
Yeah, it's such an interesting topic. It's really taken off. There's something in the critical thinking world that comes up a lot is that there's the one true cause. So a lot of people in pseudoscience, homeopathy, and some other of those that will try to claim that there's one thing that if you fix, that the rest of your world and life will improve. So sleep apnea has started to get that rap, where if you have sleep apnea and you fix it, that you can cure cancer and erectile dysfunction and anything else that ails you. And that's a problem because sleep apnea is an incredibly important topic. It has serious health risks, health effects, and can compound other diseases to make things worse. But fixing sleep apnea doesn't do anything to cure a lot of the other stuff. And so, we had a conversation with Kent Smith recently on our podcast that was really good. He takes a pretty common sense approach to things. Someone we haven't interviewed yet, but is pretty active on Dentaltown, is Barry Glassman. I think he has a pretty common sense approach to the sleep world. And so it's an area that you can really get sucked into quick because sleep is profoundly important.
So you talked to Barry Glassman. He put an online course on sleep apnea. So what is a modern understanding of sleep apnea versus where is it extremism? How do you critically think this out?
Okay, so a moderate would be if you are obese and you have narcolepsy during the day and you have fatigue issues, you're snoring, you should address the sleep apnea because it will help to improve your wakefulness during the day. It can help improve general performance during the day, whether that's at work or in athletics or something. It can help you to control other disease entities. So, for example, somebody that's diabetic. If you're not sleeping, then it can be harder to control diabetes because you have a chronic inflammatory issue in the body, and you're never getting sleep to have that reset, so to speak. The craziness starts with cancer is a big one right now. That having sleep apnea, has some X amount of change in your cancer rates. And so if you treat the sleep apnea, then you're going to cure your cancer. And that's just not the case. So that's a pretty out there one, but real. So the basic take home for me is that sleep apnea is important, but it's not the one true cause, this overriding problem that everyone has to fix. It is an issue for a few people. Do you have it? Have you been tested?
I've never been tested. What simple screen questions would you ask or be looking for someone if you thought sleep apnea was a red flag?
Well, one is neck circumference. I think 17 inches for a guy is the critical number.
How's my neck look, Jason?
Yeah, you're a little beefy there, Howard.
Is it thick?
Yeah.
Okay. So bigger than 17-inch neck.
Yeah. It's very subjective, but if somebody looks tired all the time, and that's a pretty good indication. There's some general stuff in the office. There's a real basic Epworth sleepiness scale. It's just a real basic, I think, 6-question form that a patient can fill out, and that can be just a real introductory screening tool.
You know the 6 questions off the top of your head?
No, I don't.
Do you know why would a neck get bigger if you weren't sleeping well?
It's not that. It's that a big neck causes you to not sleep well.
Oh, okay.
Because you're usually it's somebody that's heavier, and so with that weight gain, you're reducing the airway.
Okay. So another area that's dear to me, and I want to get how you critically think this out: water fluoridation.
Yeah. Yeah, it's an interesting topic, especially for somebody like you that's a libertarian. I think it's an interesting issue in that regard, somewhat politically, in how we mandate what's in somebody's water. On the other side, I think that it's one of the best things we've done to alter caries risk in kids. It's at a point where I think the data is pretty comprehensive that there's not much benefit for adults for water fluoridation, but for kids, I think it's a game changer in the positive.
So what would you say to some guy who just says to you, it's toxic, it's cancer causing, it's a waste product of the aluminum industry, it's so toxic they can't dispose of it, so they're in cahoots with the government and they just slowly pour it into your water supply? How do you talk to people like that?
It's not easy. Most people that are like that aren't interested in having a conversation. Instead, they're wanting to just get their point across, and they're not open to any other things. And so as much as I try, I will attempt to give some evidence, just showing the years and years of documented fluoridation areas and the lack of change in cancer or thyroid or bone issues. I will ask of them to provide data to support their assertion, and oftentimes that will end the conversation, or it will lead to a wild goose chase of rogue internet websites that, again,
and that's a big change I've seen in my life. When I was a little kid, you ran home after school and you watch Walter, at 5:30, and there's the whole country and just like 3 news stations, and then kind of the journalists kind of pulled everyone together. And now I've seen the just blown apart and fragmented to where everybody's finding what they want to hear already. And everybody's just switching to their own religion, politics channel. And you're right, almost everybody that comes up and tells you something is not interested in hearing the opposite. They just want to come up to you and rant their spew, and they don't want to have a conversation. The brain is like a parachute. It only works if it's open. And it's just so sad that so many people – I mean, you could explain almost all thinking just on geography. Like if you're born here, this is your language, this is your holidays, your religion, your cultures, your customs. I mean, you can find entire countries where 99% of the people don't have an original thought, custom, culture. I mean, they're just – you know what I mean? It's just like wherever you are born is going to determine almost your entire life. And it's kind of sad.
And, well, the funny thing about that is if you point that out to somebody that's never considered that before, I haven't been able to be in the presence when the light bulb goes off about that fact. But yeah, I think it's a fascinating area, especially for religion. If you're born in the States, you're a certain way, and if you're born in India, it's different.
I know.
And so I think it's just a fascinating area. And one really important piece that we just talked about is that you have to have an open mind and be open to receiving new information and new evidence. And that's what's incredibly difficult in life and in dentistry, is being able to evaluate that evidence when it comes in and knowing the good from the bad. And it's hard sometimes to sort out the garbage.
And that's why I've had an intellectual love affair with you for 20 years, because we're just two open minds that are everything I think is transparent in my columns on your podcast. And man, if I'm wrong, tell me. And so what else do you see in dentistry out there? We're down to 20 minutes. What else do you see where you wish dentists were better critical thinkers? And I'll give you something I lived through. When I got out of school, the adhesive dentistry guys were saying that the amalgam wedges the teeth apart and they're all going to fail, and the bonding glues it together. In fact, the tooth is stronger after an MOD composite than before it was placed, and you're just a hack, horrible guy dentist placing amalgam. And then you're kind of like looking at the research today and it's like, well, don't amalgams last like 35 years and these two-colored things 5 to 10? Talk about that.
Yeah, I think that's another great area that we are. I'm
going to put you on the spot and throw you under a bus. What lasts longer, an MOD amalgam or an MOD composite?
Yeah, I think the data would show that an amalgam. And I think that again, this is going to be opinion jumping in here, but I think that amalgam is less technique sensitive. And so because of that, it's hard to do comparative analysis. And so if we were to take a look at data that were placed under the same circumstances, so the same sort of isolation, same parameters of size and shape and all that kind of stuff, I'm curious which would still last the longest. I don't think one would be superior necessarily. I think they would be more similar.
Jason,
but I think in real life circumstances of wet finger dentists and wet mouths that are not necessarily isolating and not doing all that stuff, and there's blood and there's movement and all that kind of stuff, that the amalgam in a lot of cases is the better solution.
Yeah, I lectured in 4 continents in the last 29 days. And even within this great country here, I mean, you have I've seen dentists. What do you think about the practice that doesn't even have amalgam? So he has an 80-year-old lady in his patient, full-blown Alzheimer's, doesn't know her name, no brushing, no home care in a nursing home, and he's doing buccal composites on root surface decay. I mean, shouldn't that have been an amalgam? And you might think, or a glass ionomer, but a glass ionomer and a composite, I kind of need a cooperating patient. I need right. to get dry isolation. And then I said that, doctor, how can you be a doctor and for this exact person, you don't even have amalgam? What is your thought on that exact case? I mean, what do you think about a doctor who says, I don't even have the option? And then I come back and say, really? You saw 2,000 people last year and not one person had a superior indication for an amalgam?
Well, I think that's where we get into the ability of the doctor to have clinical judgment in a way that there's a restoration provided that is adequate for that situation. And so, like you said, in those instances, I think glass ionomer is a reasonable solution, assuming that you can achieve isolation for it. So, and even with that, again, I'm arguing from a point of selfishness here, but if you have a DO on number 15 and you can't get it isolated, why is shoving an amalgam into a wet, bloody hole any better than shoving a composite? And there's arguments to be made, I think, for some of the antibacterial effects of the amalgam or whatever, but the fact is that both of those are poor choices. And so,
but an amalgam is more bacterial static with the tin ions flying out than an inert plastic composite.
Yeah, absolutely. But I don't think that allows it that doesn't make it okay to place into compromised situations. Mm-hmm. And so it becomes, that's where I really like the idea of evidence-based dentistry and copying off of evidence-based medicine and using our best available evidence combined with clinical judgment and the patient's wants, needs, and desires to form a decision for that patient. And so what that's going to mean is you're not going to treat every patient strictly by what the evidence says is the absolute best. What you're going to do is you're going to say, okay, patient, you would best benefit from an amalgam in this situation. However, this restoration is less long-lasting, has this potential under these circumstances, and I'm either comfortable placing it or I'm not. Are you comfortable receiving that or not? And so I believe in an open dialogue with the patient to come to an agreement on what treatment is the best.
And you know what I'd like to see in the next 10, 20 years? I'd like to see, for 20 years, all these composite and tooth colored, they're all talking about the wear and the bonding rate. It's just bonding wear. When are they going to introduce something bacterial static? When are they going to release the composites? Hey, put in this tooth colored filling and it releases something that bugs don't like. When are we going to start seeing bacterial static restorations and materials?
That's an awesome idea. Do you have Kanka working on that?
But I mean, isn't that the logical next step? Is put something in there bacterial static.
Well, isn't that the idea behind glass ionomers
Yes.
and releasing
Yeah.
fluoride?
And this is what's interesting. All these countries have great civilizations. A lot of them go back 3, 4, 5,000 years. And why is it that the great dentists of Australia and Japan use far more glass ionomer than the United States? I mean, those are critically highly educated. I mean, a lot of countries, their dental school program, 4 out of 5 dentists go to, quote, a private school, and it's just 2 years straight out of high school, and they're graduating, 18, 20 years old, and they're a dentist. But these are civilizations where dental school is still a 6, 8 year program. So how do you have critical thinking if you have this great Australia, Japan region using far more glass ionomer than the United States? Because wouldn't someone have to be more right and someone have to be more wrong? I mean, could they both equally be making the same best decision?
They could. And it's also possible that one is more right and one's more wrong. And I don't know which it would be.
Like, it's funny because you've heard of sandwich techniques and open sandwich techniques. So they put glass ionomer on the floor. They want on the interproximal boxes, they want an exchange of fluoride and calcium and phosphorus. And then they put a layer of bread sandwich composite on the top. And in the United States, if you say to a dentist, hey, do you ever do the sandwich technique? They're like, what?
Yeah, I think that demonstrates a severe lack in our dental research as well, in that we don't have great data on that. There is a practice-based research network now that is becoming more and more active, where they're getting data from actual dentists in real life that are tracking things and presenting the data as it becomes available. And that's going to be really interesting to see over the next 5 to 10 years.
What do you think of the evidence-based dentistry movement? Do you think that's taking off? Do you think that's showing any dividends yet? Do you think that's something more of the future?
I think it's coming slowly, and some fighting it more than others, but I think it's on its way, and there's a lot of good to be had with that movement, in my opinion. And
I still cringe on the 3 major software companies, Dentrix, EagleSoft, SoftDent. You can put in DO composite, but it's not prompting them. What was it? What was your bonding agent? So that the next generation dentist can say, oh, here's 2 patients, and Howie did this on this one and this on this one, and these all last 7 years and these all last 14. We're not even we're going all digital, but our practice management software is not asking the right questions, so that our grandchildren can just have an enormous amount of data, So I'm unfortunately, I'm down to only 12 minutes with you. So what other areas of critical thinking do you see in dentistry that gets you to scratch your head? We talked about water fluoridation, sleep apnea, Cariology.
Well, I think in general, dentistry is finally starting to come around with it. In general, the research. So, we have a lot of bench research, and translating that to people is hard, and doing the research that we need on people is hard. So even something like Cariology, when we're doing it on people, because of the host of things that are involved in the process, it's a challenge to do research on people. And so as we continue to move forward, I think getting more and more data that is of a good quality in dentistry is going to help all of us practice better, to make better choices, and ultimately have better results for our patients. But I think it's a long time, slow process in coming. A bigger risk, I think, is the involvement of insurance companies in our decision making, because we're already starting to see the snippets of it, the very beginnings, with the outcomes-based stuff. And I know this is switching gears a bit from what we were talking about, but the insurance companies are going to have a field day with this outcomes-based reimbursement that has already started in medicine and is going to be coming into dentistry in the next 5 to 10 years. And unfortunately, the dental insurance companies are leading that, not the dentists. And so instead of us being leaders and standing up and saying, let's take this by the reins and lead it, we're going to be trailing behind, kicking and screaming, complaining about what's happening.
And explain what it means. Like, what's your worst case?
Yeah, so I'm going to use implants as an example. What's going to happen is that you place an implant, and there's going to be a follow-up that is the implant still there in X number of years. And so then over time, you're going to develop a profile and it's what your success rate is, basically. So it's already happened pretty widely across Europe. And so you can get data on the success rate of a surgeon in a hospital for a hip replacement. And with that information, make a decision on where you want to go for your hip replacement, assuming you can get there and afford it and all that. Same thing's going to happen in dentistry.
And tell them what the negative of that is. Because
the negative to that is the insurance company, by the insurance company controlling that, it's going to mean that they have the data, they have the information, they're going to be limiting reimbursement for those that aren't performing as well. It's going to start limiting how much you and I take risks in the treatments we're performing.
Exactly.
And therefore, it's going to alter the treatment that we are then offering to patients.
Yeah, what I've seen from lecturing around the world is people saying that he won't do your grandpa because he's too old. He won't do it because he's a smoker. So if you're too sick, no one wants to help. And
right.
And I also think it's interesting how, when you go to London, when I got out of school, probably 99% of the dentists participated in the NIH dental system. And now, 25% have abandoned it, and the rest are just trying to see how fast they can get out of it. Well, America's deciding, oh, this is interesting. Let's get into it. It's like, well, the people that have been there 60 years, they're all trying to get out of it, and now you're just trying to get into it. So yeah, that's a complicated issue. I want to switch gears one last thing because you're a real role model to me. I follow you on Facebook, Dental Town. When I turned 50 years old, I started realizing that to be a good dentist, you got to be fit. I mean, you can't lean your 10-pound bowling ball over a head all day and not have neck injuries. And I think that you're actually a better dentist, in a better mood, a better everything if you're fit. And the last 2 years, I've been trying so hard to really get fit. Like I say, 50, disaster, first time, man. You got 7 minutes. Tell a doctor, uncomplicated doctor, just simple things he or she can do to get healthier and more fit, and how that would uncomplicate their life.
Yeah, the most basic one, and the one anybody and everybody can do, is move 5 minutes a day. Just extra movement 5 minutes a day has a positive impact on health in general. That data actually just came out, just published like a week ago. That's all it takes to get started. To beyond that, just walking 20 minutes 3 to 4 times a week has a profound impact on the brain and ability for cognition and well-being. That's from a book called Spark by John Rady. And they found movement in general releases brain-derived neurofactor, I think that's what it is, BDNF, and that has impacts on the brain functioning. So that would be the first one. The next one is eating. That's huge because it's incredibly difficult to make a change by exercise alone. In fact, it probably won't happen. You're going to lose. You can't outrun your mouth. And so instead, you've got to make changes to the diet. And like we talked about with cavities, carbs is a big one. If you're obese, if you're really needing to lose a lot of weight, then there is evidence that the low-carb, high-fat approach is more effective and healthier than the traditional just lower calorie approach.
And what diet would you like the most? Would that be the paleo diet or the beachfront, or there's 100 names?
No, Nope, I don't care what label you give it. To me, it's low carbs and higher fats. And obviously there's some caveats to that as far as eating a variety of fruits and vegetables and that kind of stuff. But one thing that it's almost a modified Atkins diet. So the problems with the Atkins diet was it's way too high in protein. And so there's some negative aspects to that part of it. And so instead, low carb, high fat. And so if you're already, I'm going to segue off of that to somebody that's already kind of in shape, at least physically looking, doesn't need to lose a ton of weight, but just has some motivation issues or whatever. And getting back to the basic movement. So it starts out with just some walking. But the other things that are fantastic for getting the body feeling better are laying on the ground, rolling side to side, crawling, and then just doing basic movements of sitting, crawling, and standing, and then going back down. That's the biggest thing we lose as we get older. We forget how to get up off the floor. We lose that dexterity. We lose that flexibility and movement. And so just keeping that as you get older and practicing that can make a world of difference on how you feel as you're hunched over that patient all day and going from that hunched over movement back up and around again.
That's amazing. So, I mean, in fact, I was sitting there thinking while you're talking that I would love to get you back for a whole hour and just do fitness and nutrition because you're an amazing. Would you be up for that?
Yeah.
And how many PrismPodcast.com? How many podcasts do you have on there now?
We have 27 episodes.
And I'm telling you guys, there's nothing this man could talk about for an hour that's not fascinating. He has the most amazing mind I know of. I think he's the best critical thinking dentist I know. So, Jason, my buddy, you have 2 minutes. It's 58 minutes. So wrap up everything you just said to uncomplicate dentistry in 2 minutes. Give me a good big close.
Wow. I don't have nearly the command of the room that you do, Howard, but I think that we covered a lot of topics, and I think there was a lot of good information there for people to simplify things in their lives, from basic cariology and educating patients to how they live their lives and just simplifying and moving a little more. And so to uncomplicate their dentistry, it's take everything and ask questions. So ask more questions to dig down and ask for evidence for the things that you're doing on a daily basis. One great thing that was done, a huge exercise for me, Nareg from Dentaltown had me do this about a year ago. He said, look at all the procedures you're doing and ask yourself why you're doing each step of those and whether or not they're important or why do you do them in the first place. And it was amazing to me how many things I was doing that were unnecessary and the assistants were doing that were unnecessary. So you can simplify your life, your assistant's life, if you just ask questions and simplify throughout.
Well, thank you, Jason, for all that you do for dentistry and for Dentaltown, and thank you for your Prism podcast, and I just think you're one hell of a guy. You're my idol, buddy.
Thanks, Howard.
Take care.
Thanks, Howard.
Bye-bye.
I appreciate
Bye-bye.
it.